You just sat down, you went, you waited, you pushed, you stood up. And within 30 seconds, it feels like you never went at all. That heavy, dull pressure sitting right behind your pubic bone. Not pain exactly. Pressure. Fullness. Like someone inflated a small balloon inside your pelvis and forgot to pop it. You go back. A trickle. You sit there, you wait, you lean forward, you push again. Nothing. You get up, wash your hands, walk back to the couch. 20 minutes later, the same signal. You go back. Another trickle. This cycle can repeat 5, 6, 7 times in a single evening. I see this in my practice every single day. 15 years of urology, and this complaint walks through my door more often than kidney stones. The words are almost always the same. Doc, it feels like my bladder never actually empties. Men say it. Women say it. People in their 40s say it. People in their 70s say it. And almost every one of them has already been told the same thing by another doctor. It's your age. It's your prostate. Take this pill. Come back in 3 months. Let me be direct with you right now. That answer is wrong. Incomplete bladder emptying is not a natural consequence of aging. It is not something you accept. It is a clinical condition with specific, identifiable causes, and those causes are correctable. But correcting them requires understanding what is actually happening inside your body. And that is something the system is not built to explain in a 12-minute office visit. What I am about to walk you through today, no one is going to volunteer at your next appointment. There is no revenue in solving a problem permanently. To fix this, you first need to understand how a healthy bladder actually works, because most people have never had it explained to them. Your bladder wall is a muscle. It is called the detrusor. Think of it as a thick, elastic balloon made of smooth muscle fibers that can contract with significant force. Below the bladder sit 2 valves. The first is the internal sphincter, an involuntary ring of muscle at the base of the bladder that stays closed automatically. The second is the external sphincter, which you control consciously. Below both of those is the urethra, the tube that carries urine out of the body. When everything works correctly, the process is precise and coordinated. The detrusor contracts in a powerful, sustained wave. Simultaneously, both sphincters relax and open in sequence. Urine flows in a strong, continuous stream. The bladder collapses flat, like wringing out a wet sponge. What remains behind should be less than 50 milliliters. You feel nothing. You walk away and you do not think about your bladder again for hours. Now here is what happens when the system breaks down. The detrusor contracts weakly or fires out of rhythm. The sphincters do not fully relax. The stream is thin, interrupted, slow. And when you stand up, 100, 200, sometimes 400 milliliters of urine is still sitting in the bottom of your bladder like standing water in a clogged sink. That residual urine is not harmless. It is warm, it is stagnant, and it is the perfect breeding ground for bacteria. It chronically irritates the bladder wall from the inside. And it is precisely why, 20 minutes after you just went, the signal fires again. Your bladder is not malfunctioning by sending that signal. It is doing exactly what it should. It is telling you there is still urine inside. The malfunction is upstream. Now here is where most people get sent down the wrong path entirely. Men walk into a clinic with this complaint, and within 5 minutes they hear the same script. Your prostate is enlarged. That's what's blocking the flow. Take this medication, it will shrink the gland, come back in 6 months. Women hear a different version of the same lazy answer. It's prolapse. It's menopause. Your pelvic floor is weak. Do some Kegels and learn to live with it. Both answers sound reasonable. Both are dangerously incomplete. Let me tell you about a patient I will call Gerald. 58 years old, retired electrician, practical man, not the type to complain without reason. Gerald came in carrying a plastic bag full of supplement bottles, saw palmetto, beta-sitosterol, pygeum, zinc capsules. He had been taking them religiously for 14 months. Doc, I've tried everything for my prostate. Nothing works. I still can't empty. I ran his labs. His PSA, the prostate cancer marker, was completely normal. His ultrasound showed a mildly enlarged prostate, grade 1. That degree of enlargement does not produce this clinical picture. It is the equivalent of a pebble sitting next to a highway. It is there, but it is not blocking traffic. Then I measured his post-void residual. Gerald urinated, said he was finished, and I scanned his bladder. 350 milliliters still inside. That is nearly a full can of soda sitting in his bladder after he believed he was done. Every single supplement in that bag was aimed at shrinking a gland that was not the problem. 14 months of effort, hundreds of dollars, zero effect. The real cause was something Gerald had never heard of, something no one at his pharmacy, no advertisement, and no previous doctor had ever mentioned to him. In clinical urology, incomplete bladder emptying comes from 3 distinct mechanisms. Each one requires a completely different intervention. Treating the wrong one does not simply fail, it can make the problem worse. The first is detrusor underactivity. Your bladder muscle has weakened. It has lost its contractile force. Think of a balloon that has been inflated and deflated thousands of times. The rubber gets thin. It stretches, but it no longer snaps back. The most common cause is chronic overdistension, years of habitually holding your urine for too long. Every time you ignore the signal and wait another hour, another 2 hours, you are stretching those muscle fibers beyond their designed capacity. Over time, they stop bouncing back. The detrusor contracts, but with the strength of a whisper instead of a shout. The second cause is bladder outlet obstruction that has nothing to do with the prostate. In men, this can be a urethral stricture, a narrowing of the tube caused by old scar tissue from an injury, infection, or medical procedure. In women, pelvic organ descent, where the uterus or bladder shifts downward and physically kinks the urethra. Imagine trying to pour water through a garden hose that someone is stepping on. The pump works fine. The exit is the problem. The third, and the one Gerald had, is detrusor sphincter dysynergia. The bladder muscle contracts, but the sphincter, instead of relaxing and opening at the same moment, clamps down tighter. Your bladder is pushing against a locked door. Picture squeezing a tube of toothpaste with the cap screwed on. Enormous pressure, nothing comes out. This is a coordination failure between your nervous system and your muscles. It is not a structural problem, it is a timing problem. And no prostate supplement on earth will fix a timing problem. Gerald's dysynergia did not appear out of nowhere. It had a cause, and that cause was neurological. Let me explain why this matters for everyone watching. Urination is not a simple mechanical act. It is a precisely timed neurological event. The circuit works like this. Stretch receptors in the bladder wall detect filling. They send a signal up through the pelvic nerves to the sacral spinal cord, the lowest segment of your spine. From there, the signal climbs to a control center deep in the brainstem called the pontine micturition center. That center evaluates the signal and sends a command back down. Contract the detrusor. Relax the sphincter. Now. The entire sequence takes fractions of a second and must be perfectly synchronized. Any disruption anywhere along that pathway, and the coordination falls apart. Diabetes is one of the most common disruptors. Chronically elevated blood sugar, even at levels most people consider borderline, slowly destroys the smallest nerve fibers in your body first, the ones in your feet, the ones in your fingertips, and the ones embedded in your bladder wall. The detrusor loses its ability to sense how full it is and how hard to contract. You do not feel this happening. There is no pain. The damage is silent and cumulative. Spinal stenosis, the narrowing of the spinal canal that compresses nerves, produces a similar disruption from a different direction. The signal from the brain cannot reach the bladder cleanly. Then there is the one almost nobody considers: chronic stress. When your sympathetic nervous system is perpetually activated, fight or flight mode running in the background all day, your body keeps the external sphincter clamped shut. It is a survival reflex. Your brain is telling your body this is not a safe time to void, and if you spend 10 or more hours a day sitting, you are physically compressing the sacral nerves at the base of your spine, the exact nerves that control this entire circuit. Sitting is not neutral, it is active damage. Now that you understand the mechanics and the neurology, Let me tell you what you are probably eating every evening that is making all of it worse. When I ask patients about their diet, most say the same thing. Doctor, I eat clean, nothing crazy. Then we go through the details. First on the list, caffeine. Not just coffee, tea, chocolate, cola, energy drinks. Caffeine is a direct bladder irritant. It stimulates the detrusor muscle to contract erratically, in small, chaotic spasms rather than one powerful, coordinated wave. You feel urgency, you rush to the bathroom, the bladder squeezes in fragments, and you leave with half your urine still inside. That evening cup of tea is actively undermining your ability to empty. Second, artificial sweeteners. Aspartame, sucralose, saccharin. Clinical research has demonstrated that these compounds irritate the bladder lining and increase both urgency and frequency without improving the quality of the void. You go more often but empty less each time. Third, alcohol. We covered its effect on antidiuretic hormone in previous discussions, but beyond that, alcohol relaxes the detrusor while simultaneously dulling the nerve signals that coordinate the void. The muscle is loose and the instructions are garbled. The result is a weak, incomplete emptying that leaves significant residual behind. Now the allies. Magnesium is essential for smooth muscle contraction. Raw pumpkin seeds, dark leafy greens, almonds. These give your detrusor the raw material it needs to fire properly. Omega-3 fatty acids from wild-caught fish or flaxseed reduce chronic pelvic inflammation that interferes with nerve signaling. And here is the counterintuitive one. Drink enough water. Patients restrict fluids thinking less input means fewer trips. The opposite happens. Concentrated urine is acidic and irritating. It inflames the bladder wall and triggers premature urgency signals. Your bladder empties better when what is inside it is dilute, not caustic. Dr. Thompson's evening rule is simple. No caffeine after 2 in the afternoon. No sweeteners at dinner. A glass of water with every meal, not after 7 in the evening. Plain food, real ingredients, no hidden irritants. This is the most practical part of everything I am going to tell you today. I give this protocol to every patient who sits in my office with incomplete emptying. It takes 5 minutes across the entire day. No equipment, no prescriptions, no cost. Part 1. Morning. Resetting the nervous system. Before you get out of bed, before you check your phone, place both hands on your lower belly and take 10 slow diaphragmatic breaths. Breathe in through the nose for 4 seconds. Feel your belly rise under your palms. Breathe out through the mouth for 6 seconds. Feel it fall. That is not meditation, that is neurology. Diaphragmatic breathing activates the parasympathetic nervous system, the branch responsible for rest, digestion, and crucially, bladder emptying. It is the direct counterweight to the fight or flight response that keeps your sphincter clamped shut all day. You are training your pelvic floor to release on command. 10 breaths, 90 seconds. Part 2. Daytime. Timed voiding with double emptying. Set a timer on your phone for every 3 hours. When it goes off, you go to the bathroom whether you feel the urge or not. You void. Then you stand up. Wait 30 seconds. Sit back down and void again. This is called double voiding, and it is one of the most effective clinical tools for reducing post-void residual. The first void empties the easy volume. The pause allows urine trapped in the upper bladder to settle downward. The second void catches what was left behind. Part 3. Evening. Reverse Kegels. Not the squeezing kind, the opposite. Sit comfortably, feet flat on the floor. Imagine your pelvic floor dropping downward like an elevator descending from the 5th floor to the ground. You are not pushing, you are releasing. Letting go of tension you did not know you were holding. 10 repetitions, 3-second hold on each release. Part 4. Before bed, the lean and press. Your final bathroom trip of the night. Sit down, void normally. Then lean your torso forward, chest toward your knees. Place both palms just above the pubic bone and apply gentle, steady pressure. Rock slowly side to side. This angles the bladder and mechanically encourages the last 50 to 100 milliliters to drain. The same volume that would have woken you at 3 in the morning. Gerald listened to everything I just described with his arms folded across his chest. I could see it in his face. He thought it was nonsense. Breathing exercises? Leaning forward on the toilet? He had spent 14 months buying supplements and swallowing capsules. The idea that the answer involved no pills at all was, in his words, hard to take seriously. But he was desperate. He had not slept through the night in over a year. He agreed to try the protocol for 2 weeks. 1 week later, he called my office. Not for an appointment, just to tell the receptionist something. It's less. I can feel it's less. I saw him at the 2-week mark. I scanned his bladder after voiding. 190 milliliters, down from 350. Still too high, but the trajectory was unmistakable. The double voiding alone was catching volume he had been leaving behind for years. He was sleeping through until 4 in the morning instead of waking at 1 and again at 3. He unfolded his arms. He started asking questions. After 1 month of consistent practice, diaphragmatic breathing every morning, timed voiding through the day, reverse Kegels in the evening, and the lean and press technique before bed, combined with eliminating his evening coffee and switching from carbonated drinks to flat water, I scanned him again. 74 milliliters, under 80. Clinically, that is considered a successful void. Gerald sat on the edge of the exam table and said something quietly, almost to himself. Doc, I forgot what it felt like to actually finish. No surgery, no catheter, no new prescriptions, no prostate medication. His bladder muscle had not changed size. His prostate had not shrunk. What changed was the coordination, the timing, the neurological sequencing of the void. His brain and his bladder were communicating again. The protocol did not add anything to his body. It removed the interference. Before we go any further, I need to say something as a physician with 15 years of clinical experience. There are symptoms that should send you straight to a doctor, not to a video, not to a supplement, not to a home protocol. Know these. First, if you suddenly cannot urinate at all, you feel the pressure, the fullness is extreme, but nothing comes out no matter how hard you strain. That is acute urinary retention. It is a medical emergency. Your bladder can rupture. Go to an emergency room immediately. Do not wait until morning. Do not try home remedies. Second, blood in your urine without pain. Remember that combination. If there is burning and blood, it is most likely an infection. Unpleasant but treatable. But if you see red or brown urine, clots in the toilet bowl, and nothing hurts, that is one of the most serious early warning signs of bladder or kidney cancer. That finding demands imaging and a cystoscopy without delay. Third, new onset back pain combined with difficulty urinating and unexplained weight loss. If you have lost 10 to 15 pounds over 2 months without trying, and your lower back or pelvis aches in a way it never has before, that pattern requires urgent investigation. Fourth, numbness or tingling in the saddle area, the region between your legs, combined with sudden changes in bladder or bowel function. That is cauda equina syndrome, compression of the nerve bundle at the base of your spinal cord. It requires emergency surgery within hours, not days, hours. Permanent damage occurs fast. Fifth, a stream that is weakened progressively over weeks, and you are now straining hard with minimal output. That gradual decline is not something to monitor casually. It needs clinical evaluation before it becomes acute retention. If none of those apply to you, you can breathe. But the quality of that life is worth protecting. And to protect it fully, there is one more piece we need to discuss. The protocol handles the mechanics. The dietary changes remove the irritants. The exercises restore the neurological coordination. But your body still needs raw materials. Muscle fibers do not strengthen without the right nutrients. Nerve pathways do not repair without adequate mineral and vitamin support. Blood flow does not optimize on willpower alone. This is where Prostavive comes in. It is a powerful blend of nutrients specifically selected to support the biological foundation that everything else depends on. Boron, once only sourced from crystallized mineral deposits in Tibet, supports your body's detoxification and maintains a healthy inflammation response. Tongkat Ali and ashwagandha, used for centuries in traditional medicine, support healthy blood circulation in the pelvic region, the exact area where Gerald's system was starved of adequate flow. Fenugreek and Panax ginseng promote healthy blood flow, sexual vitality, and immune function. Maca root boosts energy, drive, and prostate function. Artichoke extract and nettle root support urinary tract health and healthy hormone levels, the hormones that directly influence how your bladder and prostate behave. And to build the deeper foundation, Prostavive includes zinc for healthy cellular function, magnesium for smooth muscle contraction, the same mineral your detrusor needs to fire with full force, and vitamin D for prostate health and overall systemic support. Here is the mechanism that ties it all together. Prostavive supports healthy nitric oxide levels. Nitric oxide relaxes the smooth muscle lining your blood vessels, including the vessels feeding your prostate and bladder. Better blood flow means more oxygen and more nutrients reaching every cell in the pelvic region. The protocol teaches your body how to empty. Prostavive gives your body what it needs to rebuild the strength to do it. 1 scoop a day. If you want to try Prostavive for yourself, simply click on the logo of my channel. You will find the product right there on my channel page. Take a look, see what thousands of men are already experiencing, and decide for yourself. Your bladder is not broken. It is not your enemy. It just needs the right support.